What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central store processor? Guys, we're going back to basics and decontamination with retractors. Now, guys, retractors are, again, another surgical instrument that's just about in every single tray. Again, said we're going back to basics, so these are the basic instruments that you'll probably always come across and are very familiar to you. Again, I'm not going to go into the identification of the instrumentation because, again, there are people out there that do it way better than me. So, but I will tell you the basics of it. So we have two different types of retractors here. We have self-retaining retractors and we have handheld retractors. So what's the difference? All of them you got to hold with your hand, right, at some point or another. But self-retaining retractors have ratchets on it, right? So when you put it into a wound and you crank it, okay, it's going to hold the wound open without any force needed afterwards, right? So that's going to hold the wound open. Compared to a handheld retractor, that we have a wound, we have to place a retractor in there, and somebody has to physically hold that wound open, right? So this is a handheld retractor. This is a self-retaining retractor, right? Anything with like a ratchet on it of some sort. So in decontamination, self-retaining retractors and handheld retractors are pretty straightforward. Handheld ones are probably the easiest ones because they're usually made of one solid piece. Not much to it, right? Okay, and you notice I didn't grab this one because this one, even though it's solid, this one's actually considered a self-retaining because it's weighted. It's a weighted retractor, so it goes into yeah, it goes into I'm tongue-tied, right? Ooh la la. It goes into the cavity, and the weight of itself opens up the cavity, right? So this is a weighted speculum, so it's actually a self-retaining. So it does require some, you'll see some surgeons actually help pull down and then the weight will keep it open. But the self-retaining ones usually have some kind of screws or mechanisms, ratchets, things of that nature. So you want to make sure in decontamination that you're opening these things up and you're looking in the joint. So let's go into the anatomy of it very quickly. And it's almost the same with both retractors. So you have the working end, okay, or the jaw area or the manipulating area. You have a shaft, okay. In this case, you actually have a box lock. You have this another set of shafts, rings, and then the ratcheting mechanism. Okay. For handheld retractors, you have the working end or the jaw, or the manipulating edge. You have the shaft, and then you have the handle. Okay. Same difference here. If it's double-ended, you have the jaws, right, or the working end. You have the shaft and the handle. Again, so this would actually act as a handle depending on which end you're going to put in. It's a handle. With anything like a malleable one that you can manipulate, the handle can be at any end and the working end can be in either end. So even though it looks like a straight, it can be manipulated and changed into different shapes to fit the needs. So in decontamination, it's the same thing, guys, with all your instrumentation. If you're manually cleaning, you're giving it a good rinse to remove gross soils. You're opening them up as far as possible as you can if they can be opened, okay? Paying close attention to any joints or any areas. It may be required that during the rinse, you want to give it a good little scrub in between to remove that visible soil. And then you're going into your soak. In your detergent, you want to soak for whatever the manufacturer's recommendation or the recommendation from the detergent. allow the chemical to do its job. Remember, right time, right concentration, right contact, and then we're gonna clean friction, right? Again, please avoid the metal brushes, okay? You can use metal brushes. I'm not saying that you can't, but you have to be responsible with it. You can't just go crazy on everything. If it's a soil that's not very difficult to remove, okay, the nylon, and if you allow the chemical to do its job, it will come off very easily with the nylon brush. If you're just trying to remove a stain or remove a soil and you didn't let the chemical do its job, you're going to be finding yourself using that metal brush more often than not. But all the soils after soaking should come off fairly easy with the soft bristle brush. Anything with teeth, you want to make sure you're paying attention in between those teeth, okay? Especially some of the cat claws or sun retractors or Matthias retractors. You want to get in between those jaws and I'm sorry, looking at using the metal side. Get in with the bristles and get in there really good under the surface of the water, okay, because that's where those soils are going to be caught up in. Okay, with the handheld ones, if they have any cannulation, you want to get in there. If you have a brush that you can go down there, you should go ahead and brush it with a cannulated, with a bottle or a cannulation style brush to get down there, because there'll be soils that groove there is made for a reason. When you're holding a wound open downwards, the blood actually travels down that cannula. Same thing with this retractor here, okay? Blood is designed to drip down this cannula rather than all over the instrument. It's designed to drip down this cannula, so that's where you'll see blood caked up in there. So it's good to get in there with a brush and get in there really good, okay? The working end, of course, okay? For items that are this big, you can go ahead and use a sponge and get in there really good and clean it off. Once you've cleaned your instrument and your detergent, you want to go to your final sink and rinse it off with critical water. And that is the completion of the manual cleaning process. Again, I have to state that the manual preparation process is almost the same, except you're gonna do a rinse, okay? You may be required to soak in detergent to help loosen up the soil, and then to the next, then to rinse that off with critical water, and then into the next step, which may be ultrasonicking or straight into the washer disinfector. Again, manual prepping skips on the tedious task of brushing every single instrument. You're only doing it to remove the visible soils and not all the soils, right? So because you're relying on the mechanical actions of the ultrasonic or the washer disinfector to remove the soils that we cannot see. Remember, you can't put items in an ultrasonic or washer disinfectant with gross soils. You want to remove those gross soils before you throw them in there. And I'm not going to say the washer disinfectant because I know the IFUs for the ultrasonic says no gross soil. All right. So also another note before we end, some self-retaining retractors can come apart. So if it can, please note that you must take it apart. So you want to go ahead, take whatever removable parts you can get out of there and remove those parts. If there are screws that open up all the way, you want to make sure you open that all the way. And then other retractors, they put disposable items on there. So make sure that you're looking for these. So some of these are reprocessable. So you have to look at, like with some of the mouth gags that have the little rubber inserts, some of these can be reprocessed. Check with your hospital policy whether you're going to replace these every single time or you're going to take them off, clean them, and then replace them. But that's about it for Decon, guys. As always, stay true to yourselves. Keep it 100. Continue to educate yourself. And until next time, peace.